Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has chosen as Editor's Choice and Highlights for the November 2013 issue of our journal. This month's Editor's Choice is the original article entitled Influence of Beta Blockers and Other Antihypertensive Drugs and Risk of Melanoma Recurrence and Death, written by Dr. Vincenzo De Giorgi and colleagues from the University of Florence in Florence, Italy, and from the European Institute of Oncology in Milan, Italy. In this study, the use of beta blockers was associated with a reduced risk of melanoma recurrence and death, which confirmed and strengthened previously published data. The authors call for future randomized clinical trials to provide more definitive information. The accompanying editorial entitled, Does Our Fight or Flight Response Have a Link with Cancer?, was written by Dr. Manish Kohli, who is Section Editor for Oncology on the Mayo Clinic Proceedings Editorial Board. In his opinion, the article by De Giorgi and colleagues is early in the evolutionary scale of evidence gathering, and he emphasizes the need for more robust prospective evaluation, including an important concept in pharmacoepidemiology called immortal time bias. One of this month's featured highlights is the original article entitled Statins and Cognition, a systematic review and meta-analysis of short and long-term cognitive effects. It was written by Dr. Christopher Swiger and colleagues from Johns Hopkins University in Baltimore, Maryland. The author's data suggests no adverse effect of statins on cognition in the short term and support a beneficial role for statins in the prevention of dementia in the long term. The second featured highlight in this month's issue is the special article entitled Guns, Schools, and the Mentally Ill, Potential Concerns for Physicians and Mental Health Professionals, authored by Drs. Brian Hall and Susan Friedman from the University of Central Florida in Orlando, Florida, and Case Western Reserve University in Cleveland, Ohio. The authors offer concern about how public discussion is focusing on mentally ill individuals, early detection of mental illness during school years, and the interaction of such individuals with physicians in the mental health system. They cite examples of what they consider potentially troublesome legislation and offer suggestions on what can be done that will, in their opinion, improve safety for patients and the public. The accompanying editorial entitled A Good Idea Shot Down, Taking Guns Away from the Mentally Ill Won't Eliminate Mass Shootings, was authored by Dr. Michael Bostwick from Mayo Clinic in Rochester, Minnesota, who is Section Editor for Psychiatry on the Mayo Clinic Proceedings Editorial Board. From the perspective of one who was raised in a family that did not own or use guns, Dr. Bostwick feels that the article by Hall and Friedman makes a convincing argument that laws designed to keep firearms from the mentally ill would not prevent mass shootings such as those that occurred recently in Arizona, Colorado, or Connecticut. The third featured highlight in this month's issue is the concise review for clinicians entitled Maternal and Neonatal Complications of Elective Early-Term Deliveries, that was authored by Drs. Gianni Jensen, Wendy White, and Charles Covington from Mayo Clinic in Rochester, Minnesota. The authors highlight that the 10 to 15% of all deliveries in the United States that are performed before 39 completed weeks of gestation have increased maternal and neonatal complications compared to deliveries that occur at late-term gestation. The authors describe various strategies that have been used to increase awareness of the morbidities associated with the practice of elective early-term delivery and to reduce its frequency. Also featured on the cover page of our November 2013 issue are the following articles. A review entitled Lipoprotein A, Cardiovascular Disease and Contemporary Management, that was authored by Dr. Terry Jacobson from Emory University in Atlanta, Georgia. The original article entitled International Travel by Persons with Medical Comorbidities, Understanding Risks and Providing Advice, that was authored by Dr. Natasha Hochberg from Boston University in Boston, Massachusetts, and colleagues from several other national healthcare institutions. The original article entitled 80-fluorodeoxyglucose positron emission tomography in patients with active myelopathy, that was authored by Dr. Erin Flanagan colleagues from Mayo Clinic in Rochester, Minnesota. This last article has an accompanying editorial entitled Positron Emission Tomography in Spinal Cord Disease, that was authored by Dr. Gupta from Mayo Clinic in Jacksonville, Florida. In this month's issue of Mayo Clinic Proceedings, our Symposium on Regenerative Medicine continues with an article entitled Advances in Regenerative Orthopaedics, which was authored by Dr. Christopher Evans from Beth Israel Deaconess Medical Center, Harvard Medical School in Boston, Massachusetts. Two of the articles in our November 2013 issue provide teaching exercises for which you can receive up to 1 hour of CME credit if you complete the appropriate documentation. Video interviews are available with authors of most of the articles mentioned in this recording and some others as well. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Dr. John Hefner, a pulmonary disease and critical care medicine specialist from Providence Medical Center in Portland, Oregon, who is a long-standing Mayo Clinic Proceedings editorial board member and who currently serves as a member at large. And just to remind you again, you can find on our homepage a number of online-only features that are not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, art at Mayo Clinic, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the November 2013 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the next issue of Mayo Clinic Proceedings, which will go live on our website on December 2nd, 2013, will contain articles entitled Physician Satisfaction and Burnout at Different Career Stages, Protective Role of Resting Heart Rate on All-Cause and Cardiovascular Disease Mortality, and Our Treatment Approach to Chronic Hepatitis C. In the meantime, you can watch videos related to our journal content on our YouTube channel. You can also follow us on Twitter and like us on Facebook to stay up to date on online first publications and on breaking news related to our journal. Direct links to our YouTube, Facebook, and Twitter presences can be found in the upper right-hand corner of our homepage. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.